If you don't smoke, chances are you've been annoyed by the smoke from someone else's cigarette. Now, there's good evidence that this sort of smoke, called environmental tobacco smoke, can be hazardous to your health. Now, children are at risk as well, as Dr. Joseph Bocchini explains.
Passive smoke exposure is considered by the American Academy of Pediatrics to be one of the most common and most important environmental hazards that can be prevented in children.
Environmental tobacco smoke contains over 60 toxic substances, including arsenic, cyanide, and carbon monoxide. In adults, this can increase the risk of heart disease, cancer, and asthma. And what about in kids?
Passive cigarette exposure has been associated with worsening respiratory infections, particularly in young children with common viral respiratory infections. They have a much higher chance of developing lower tract infection involving their lungs, and even a higher chance of requiring hospitalization. And children exposed to passive cigarette smoke have a much higher likelihood of having ear infections, both acute infections and chronic ear infections.
Even unborn children are at risk. Expectant mothers who smoke expose their child to the risk of passive smoking. This can result in lower birth weights, which can lead to complications for the infant after delivery. As you've heard, environmental tobacco smoke is more than just an annoyance. It's a clear health threat for you and your child. From the LSU Health Sciences Center in Shreveport, I'm Dr. Keith Payne.